Welcome back to the show, everybody. Well, here to explain cosmetic surgery options for all ages is Dr. Zel Krajden.
Welcome to the show.
Thank you so much.
Thanks so much. Welcome,
Thank you, Steve.
Great to have you here. Okay, so the face of plastic surgery is really changing. What are the trends that we're seeing?
It's changed dramatically over the last 20 to 30 years. It used to be a one revolutionary change when you were 60, huge facelifts.
Right.
Now we're going with a more evolutionary change in your 30s, 40s, and 50s by renovating one room at a time and doing it in a soft, subtle way.
And I kind of like that.
I like that decor reference.
Instead of buying a new house, we're just renovating small rooms.
Exactly.
I like it.
So we start a little earlier. So we're going to start in our 20s, 30s? When you want to start starting in your 30s. Okay, so let's start there.
Yeah, what are we focusing on? What's happening to our face in our 30s?
So when I look at the 30s, that's when you're starting to see the early signs of facial aging.
Okay.
You're starting to see fine lines,
Right.
pigmentary changes, large pores. And this is often the effects of sun damage, thin skin, weight fluctuations.
All right, so you're saying your early 30s, this is starting to happen to a lot of our faces.
So when I look at this, I start thinking of the 30s as prevention and minor correction. So in terms of prevention, sunscreen, good diet, not smoking.
Right. Those are the basics that we should all embrace that.
Definitely,
that's an easy,
no matter what age you are.
and that's an inexpensive one to embrace.
Of course.
Okay, so
and what about a common procedure that you can do?
Look at the 30s, most common thing would be something called a FotoFacial.
Okay.
It is a light-based treatment that helps to improve things like irregular pigmentation, usually darker spots, fine lines, and large pores around the nose and forehead areas.
Okay, that starts to happen again in the 30s.
Usually in the 30s.
And this is a quick procedure?
Quick procedure, in and out within about an hour.
Okay.
Small discomfort. Generally about 5 separate treatments to achieve reasonable results.
And this is the after that we're seeing right here.
Exactly.
This woman, she looks absolutely, her skin is radiant, and it's just it's much more even.
And this is just FotoFacial. No Botox, no filler, no surgery.
Nothing, just that. And rough cost?
Looking at about $2,000 and up, depending on community, depending on how many treatments you actually need.
Okay.
Okay, that's great. All right, so this is really nice to see. I'm going to go get one of those now. Okay.
Now, our early 40s. So, again, what's happening to our face, and what are we focusing on?
In the 40s, you start seeing real changes, and I call it the 3 Ds. Descent, deflation, and skin deterioration.
No. Okay.
Hello, 40s.
Hello, 40s.
And again, it's a continuum. It affects different people at different ages, but generally in the 40s, you start to see 2 or at least 3 of those changes.
So again, lifestyle will play a part in how you're aging differently from other people. If you smoke, you drink, you party, you're probably not going to look as fabulous as someone who's very healthy and whose weight doesn't fluctuate.
Exactly.
So what happens when your weight fluctuates? Are you stretching the skin?
Exactly.
Oh, really?
So as you age, you actually lose facial fat. As you lose facial fat, you start having less prominent cheekbones, less prominent jawline, and your facial features become from a soft, subtle thing to more of a harsh, aged look.
Right, okay. And common procedure that you would do?
Botox would be number 1. Botox is the most common injectable procedure in North America today.
Yes,
it's been on the market for 20 years. And you can treat all types of different problems just with Botox alone.
So where do you focus on in the 40s? What areas would you focus on? Where are you focusing?
I mean, this particular lady, light skin, aging,
Yeah.
you're looking at the glabellar area between the eyes, the forehead, and beside the eyes. Because the eyes really are the window to the soul. Often people who have great facial structure, their eyes are looking tired, droopy, thin skin, dark circles.
Right. And also into here, then what is that called?
This is called the marionette lines.
The marionette?
I thought they were nasolabial folds. Is that what they are?
Some people they are. That's the fancier name for it.
Is that a fancier name? I learned it when I was in makeup school 160 years ago. Yeah.
Or 39 years ago.
39? Yeah, exactly. Okay, so the Botox.
This woman had Botox then for
Yes,
this,
she did.
correct?
Botox and filler.
So she had it in through here?
Yeah, Botox in the upper third of the face. I want fillers. So the main type of filler is an injectable, similar to a gel type consistency. The most common type is something called Voluma, and it allows you to restore facial anatomy, facial structure, reshape the face with regard to the cheekbones, those folds, marionette lines, and around the jawline as well.
And rough cost for this?
Looking at over $2,000, roughly once every 1 to 2 years.
So we're getting into some higher price ranges here. And what happens? How long are we going to see these effects last for? Because when you invest $2,000,
Botox roughly 6 months. Filler roughly 1 to 2 years.
So that's a nice span of time.
2 years is significant.
So it's a good investment. You break that up over 2 years. This is a good investment. Okay.
Now let's go to our late 40s.
As you get into the later 40s, now you're looking at eye-based procedures. Most people, as they get older, a little bit of extra skin, thin skin down here, extra fatty tissue. You can have what's called an eye lift or a blepharoplasty. blepharoplasty, usually done under local or twilight anesthesia in order to contour extra skin, that hooding in that area.
I like the twilight. So what's this twilight when you're talking about
twilight? Anesthesia.
It sounds like going to a spa.
It's
twilight.
It's wonderful.
Going into twilight land.
It's wonderful. A little bit of sedation. So you're awake, you're breathing on your own, but that sedation allows you just to relax, allows a surgeon to work in a peaceful environment for them and for yourself.
So you're not chatting away to him while you're trying to do some stuff like, hey, what are you doing up there? Yeah, okay.
And rough cost on this one?
Rough cost, upper eyelid only under local, $2,000, upwards of $6,000 to $7,000 for upper and lower eyelid.
This is an extreme before and after. This is a very big difference here. This is a happy lady, I'm sure.
A very happy patient, someone who had the perfect anatomy for it. Early aging, lots of skin, otherwise very good facial bone structure.
Perfect. Really, she looks great.
So now we're getting into our 50s. So
what's happening to us now?
To our face?
Well, in your 50s, you want to look at either non-surgical options or more invasive excisional surgical options. Usually in your 50s, you've had more skin descent. There's extra skin and soft tissue in the facial area. This is a lady who did not want any surgical procedure, did not want a scalpel touching her skin, so to speak. And she had high volume, so it's the same continuum of Botox and filler, and now getting to things like FaceTite, which helps to contour.
FaceTite.
It's a heat-based technique, and it allows you to improve those areas around the lower eyelid called festoons. It allows you to tighten up the nasolabial folds in towards there. And by adding the extra filler there, you restore a nice triangular shape to the face.
So what can you promise this lady? You can promise her 10 years younger? Can you say to her, you are going to look 10 years younger?
5 to 7, with non-surgical, 5 to 7 years younger.
5 to 7 years younger. That's a nice couple of years.
And you want a soft, subtle look.
Next, let's talk about the next procedure. What is
the next one here?
This is invasive.
This is invasive.
This is more invasive. This would be a surgical facelift.
This is a massive change.
Huge change.
Wow.
I mean, I always tell my patients, less is more. I try and be the voice of reason. Both my parents are doctors. I still do half reconstructive and trauma surgery. So if you're having a surgical procedure, it has to be done by the right surgeon, and from your point of view, at the right time of your life, when you're ready for it emotionally, physically, and in terms of downtime.
And be realistic about your expectations.
Exactly. You have to be realistic with your facial structure and your looks.
We have to go to break, but we're out of time, but I definitely want to know how much this is going to cost.
$8,000 to $12,000.
$8,000 to $12,000. That's investment.
Exactly.
You do this once.
Exactly. And this is 7 to 10 years younger.
Immediately. You're just going to come
looking
so refreshed. Well, thank you so much for being here.
Very much.
Absolutely.
Wonderful. Okay, everybody, we're going to take a quick break. When we come back, our Frugalista is here with some very fantastic when he's taking tips. Don't go away.
Great stuff. Thank you so much.
Thank you, guys.
Really good information.